So as she said, I'm Randy Wyckoff, the Dean of the College of Public Health, and I'm going to talk to you a little bit about the College of Public Health, right? And you can see I'm a physician, also trained in public health with a tropical medicine degree. People always ask what the TM stands for, and that stands for tropical medicine. So I want to cover three things today. I want to give you a sense of what public health is, right, and why it's important. Because no matter what field of health you go into, public health is an important thing for you to understand. I want to talk to you a little bit about what options exist for you to study in the college should you choose to do that. And lastly, I want to talk to you about why you might choose to study in the college or might not. I want to be real clear at this point. If you've got a good major, you're comfortable with it, you're happy with it, I'm not trying to get you to change. I'm simply trying to give you a set of options that you might have to consider if you don't know exactly what you want to major in yet. And let me just get a sense from you all. How many see yourself pre-med? Like to go to medical school? Okay. Occupational therapy, physical therapy, audiology, speech pathology, nursing, PA, physician assistant. What have I left out? Dental, vet. Okay. Any of you going into public health? Aha, good. You don't know that yet. Okay. Good. So you're all planning on studying one of the health sciences, right, at ETSU, eventually at some point. So reasonable to ask yourself a question, right? Did you make a good choice in coming to ETSU to study a health science, right? Did you make a good choice? And the answer, of course, is obviously no. You actually made a great choice in coming to ETSU to study the health sciences, so let me explain why that is. Some of you may recognize this, that's the United States. And in the whole U.S. there is about 2,700 colleges and universities, okay, almost 3,000 colleges and universities, right? How many of them do you think have a college of medicine, a college of pharmacy, and a college of public health that you have here at ETSU? How many of those 2,700 have those three things? You might be surprised to learn that in the whole United States there's only 26 universities that offer you the range of options that you have right here at ETSU. And that's pretty impressive. This is a university that gives you those range of opportunities to grow into. But as they say on television, but wait, there's more. Because what if we take away those universities that don't offer a doctorate in nursing, which is the highest level of nursing education that you have here at ETSU? What if we take away those universities that don't offer physical therapy, that some of you are thinking of studying? What if we take away those that don't offer audiology and speech pathology? What if we take away those that don't offer dental hygiene, radiography, and respiratory therapy, the three allied health programs at ETSU? There's only 2 universities in the country that offer you the range of health science opportunities that you have here at ETSU. That's ETSU and Ohio State. You take away the one where you'd be lost in a crowd of 65,000 students or whatever it is, and we like to say that ETSU is a hopping place in a beautiful environment, okay? Now that's a little tongue-in-cheek because there's some things we don't have here, right? We don't have a dental school, we don't have veterinary. But I want you all to appreciate the incredible opportunities that you have at ETSU. Now you may say, well, yeah, I'm an undergraduate, now how does having a medical school here help me? Because there are a whole lot of undergrads that are doing research at the med school, doing research in different programs. There's also folks, because we have a health science institution here, we have folks like Martha and others that are preparing you to enter those fields. So that's a quick introduction. I'm going to tell you why public health, why it's important, what options exist for you to study here, and why you might or might not choose to study in the College of Public Health. So what is public health? What is this thing that I teach? This is my professional area. According to the Institute of Medicine, public health is what we as a society do collectively to assure the conditions for people to be healthy. All the things that society does to make people healthier. So one way to think about it is think of all the things that go into health that don't take place in a doctor's office, a hospital, or a clinic. Everything that doesn't take place there is functionally public health. For example, outbreak investigations. Disease detectives. Who are the people that look into a meningitis outbreak? Who are the folks who try to track down a foodborne outbreak? Those are public health folks, okay? That's one of the things we do. Think about it. Your doctor, when you visit her, doesn't have the time to get out in the community and figure out how this disease is spreading. Somebody has to do that. That's public health. How about responding to disasters? No one doctor, no one hospital, no one clinic can do that. But somebody's got to prepare a community and respond to those disasters when they occur. That's public health, okay? What about protecting the environment? You know, we all talk about the environment impact on health. Doctors, hospitals can't protect it, but somebody's got to know that. Somebody's got to understand the science. You know, there's all this politics around health, right? All this politics around the environment, global climate change and all that. But somebody's got to understand the science, and that's public health. Right? Global health, people who want to make a difference around the world. People who want to, if you want to, you know, there's what, about 7 million kids every year die before they get to their 5th birthday. What are they dying from? Diarrhea, respiratory disease. They're not dying from things that require high-tech medical intervention. They're dying from things that require basic sanitation. Right? Clean water, food, basic medication, that's public health. Right? Behavior change. What's the leading preventable cause of death in America? Heart disease. What's the number one thing that causes people to get heart disease?
Bad diet.
Well, that's number 2. That's a good one. Smoking, number 1, all right? If smoking is the leading preventable cause of cancer in the U.S., we want to help kids not start smoking, right? And we want to help current smokers quit. That's public health, all right? All these things that happen outside the doctor's office, the clinic, and so on. Clinical trials. This is kind of an odd one. When you go to the doctor and you have pneumonia and she gives you an antibiotic, how does she know it's going to work? Because someone somewhere systematically evaluated the impact of that drug on that disease. That's a clinical trial done again by public health. And finally, this is one people think about the least, health policy. Who develops policy? Who decides how we're going to deliver health care and so on? Again, all of those things are part of public health. It's what I like to call evidence-based altruism. Altruism is caring about other people. Evidence-based means science-based, okay? So I call public health evidence-based altruism, using science to make a difference in other people's lives. That's what we teach. Now, that's what public health is. Let me show you why it's so important, okay? In the United States, this is a chart that came out of the New England Journal of Medicine, and it shows the things that cause us to die young, premature death, early death, right? Now, this is not, right, the five leading causes of death. You said one was heart disease. What's the second leading cause of death in America? You can guess. It's okay to be wrong. I don't know who you are. Stroke is third. Good one. What's number 2? Cancer. Heart disease, cancer, stroke, chronic obstructive pulmonary disease, and accidents. Chronic smoker's lung. So heart disease, cancer, stroke, chronic obstructive pulmonary disease, and accidents. 2/3 of Americans die from one of those 5 causes. Right? But this isn't about that. This is what leads you to get, what leads Americans to get heart disease, cancer, stroke, chronic obstructive pulmonary disease, and accidents. What are the things that cause us? Well, the first is genetics, what you inherit from your family, right? You can't do much about that. A little bit is the environment, what you're exposed to in your environment. A little bit is social circumstances you live in, poverty, lack of education, and so on, dangerous environments. That leaves 2 parts of the pie, all right? A small part and a big part. And people are surprised to learn that that small part is health care. And what that means is if all Americans had access to the very best health care, which they don't, we would reduce our early death rate by about 1/10. That's really important, right? Healthcare is really important. I'm a physician, I'm a pediatrician, I'm trained in healthcare, I believe in it. But there's this huge packet down here. 40% of our early death is caused by behaviors, things we do ourselves. All right? According to the Centers for Disease Control, the number 1 behavior that kills us is? You already said it. Smoking, number 1. All right? Number 2. You said it before too.
Diet.
Yeah, diet and exercise. Good. What's number 3, huh? No. Alcohol. Infectious diseases, toxic agents, secondhand smoke, and so on. Motor vehicles, self-explanatory. Firearms, self-explanatory. Sexual behaviors that leads to AIDS and other diseases, and illicit drug use. Those are the things the CDC says we die from. These things cause 40% of our early death in America. Now you guys as budding health professionals look at this list. Oh, now you don't know the answer to that question, do you? Oh, sorry. You look at this list, and two things should jump out at you on this list. Okay? One is these problems can be solved. Go back to this list for a second. See if you can see anything up there that you yourself wouldn't have an idea of how to solve. Other than not knowing what the words mean, you could solve anything up there. These problems can be solved. But there's a more important message on this list, and that is that these problems are more easily prevented than cured. Go back to the list and ask yourself, what are the items up there you could go to the doctor to be cured of? Arguably, the only one is infectious diseases, microbial agents. Everything else requires prevention. Everything else requires a societal intervention. These are the things that are really killing Americans. And if you really want to make a difference in them, whether you're a doctor, a nurse, a pharmacist, or anything else, you've got to engage in public health. You've got to work at the community level, because these are the things we're dying from, and they have to be prevented. All right? So it doesn't matter what field you go into, you've got to understand public health, whether you choose to study it or not. And this is really important for us in Tennessee, because if you look at life expectancy of all 50 states, from Hawaii at the top to Mississippi at the bottom, there's Tennessee, the 7th least healthy state in the nation. How many of you are from Tennessee? Virginia? North Carolina? What else have I left out? Any states? Anyone else? Where are you from?
Cincinnati, Ohio.
Ohio, okay. Well, you know what's interesting is some states like Virginia look pretty good up here, but that's because you have that big, wealthy, healthy area up by Washington, D.C. Right? Some parts of Virginia are more like Tennessee. Right? But the point being, if you really want to make a difference in the health of the people you serve, whether you're a doctor, a nurse, whatever it is, you've got to understand that to make the real difference, you've got to work at the community level, and that's what we call public health. So that's why public health is and what it's important. What options exist for you to study in the College of Public Health? There's basically 3 degrees that we have as an undergraduate. You can get a BS in Health Sciences with a concentration in microbiology or human health. Those are great degrees. My own son graduated with a degree in microbiology. He was very pleased. Dr. Chakraborty, the chair of the department, is back there. He's excited about it too. We have a BS in environmental health. Again, this is not environmental activism. This is really understanding how the environment impacts health. Really, really important. The more people debate about the environment, the more important it is to really understand the facts. What really makes a difference? What contaminants in the environment have what effect in human health? And then we have a BS in public health with 2 concentrations, healthcare administration and community health. Healthcare administration is typically folks who go into the management systems of hospitals, nursing homes, and so on, and community health is behavior change. Now, I'm not going to talk about these because later this morning or this afternoon you're going to hear from each department. They're going to tell you the details of it. I will simply tell you that we also have 6 master's degrees and 3 doctoral degrees. Should you choose public health as a field, right here at ETSU, you can get all the way through and get a doctorate in environmental health or in public health. All right? That's all I'm going to say about that. Now, why might you choose to study in the College of Public Health? Again, I'm not trying to convince anyone to change majors, but I want you to understand why you might. So let's ask the question, why should you choose any major? Right? To me, as a parent of 3 kids at ETSU right now, I can tell you why you should choose a major. Okay? Yeah, and 2 of them are studying in the college. Well, one graduated from the college, one's in the College of Public Health, one's a digital media major. Yeah. Okay. Any major at all, you should choose for one of 2 reasons, right? It's something that you find enjoyable, interesting, or challenging. And 2, it's a major that will help you achieve your career objectives, right? Now, I can't answer either of those questions for you because I don't know what you find enjoyable, interesting, and challenging, and I don't know what your career objectives are. So let me tell you what I know about our graduates as it relates to each of these questions. And I'm going to start with the second one first. I'm going to tell you about job placement and graduate school placement rates, internship requirement, what our preceptors say about our interns, and what our employers say, okay? Again, I can't answer the question for you. This is what I know. We do something called the alumni survey. A year to a year and a half after graduation, we survey all of our graduates, okay? The last 125 grads from our college, by the time of the survey, 97% of them were either in graduate school or in a job. All right? Looking at the most recent group, where did they go? A third of them were in grad school. Next group working for hospitals. Next one nonprofit, government, industry. We had one student who wasn't looking for a job and one who was. All right? So there was one student a year and a half out who didn't have a job. Now that may mean they had a job and they quit. The one who wasn't looking could be someone whose life was in a transition or whatever. But you should know this is the outcome. This is where they went. Pretty, all largely in their field of study or in graduate school. All right? Now, one of the reasons that we have such a high job placement rate is that in public health and environmental health, we require our students to complete an internship. So you do a 2 to 3 month on-the-job internship before you graduate. In the last 5 years, our students have completed 318 internships in 17 states and 11 countries. We've had students in South Africa, Peru, Rwanda, Tanzania, Guatemala, Honduras, Nicaragua, American Samoa, as well as 17 states in the U.S. This is important to you because an internship is an opportunity to take everything you've learned and see if you're ready to apply it in the real world. We have about 180 memoranda of understanding with organizations like hospitals, nursing homes, large and small companies, local and national government, international, domestic. The point being, there's pretty much no limit to where you can go. If you're particularly interested in nursing homes, you can do your internship there. If you're particularly interested in global health, you can go overseas as well. Think of it as a 3-month job interview. Right? We haven't done the statistics lately, but when we looked at it about 4 or 5 years ago, about a third of our undergrads were actually getting offered a job where they did their internship. Right? So it's not a bad opportunity. Oh, and we also asked the preceptors to tell us how good are these students. So you don't get away with just working for 3 months, you actually get a grade for the class. And in between 2008 and 2012, we had 143 preceptor evaluations. They ranked our undergraduates 4.57 out of a total of 5, and you can see the different characteristics there. I'm not going to read them all to you, but I'm particularly proud of things like work ethic, reliability, critical thinking, and so on. We compared the 2008 cohort to the 2012 cohort, and you can see we went up from an average of 4.5 to 4.7. And that's actually important, probably more important to me than it is to you. But what this tells me is that we are doing something right, which is we're constantly asking the profession, how can we get our students better prepared for the job market? Okay? Last year, every single department brought together a working group of employers and graduate school reps, and we asked them, are we getting the right things for our students? When students do their field placement, they come back and they tell us what they wish they had known before they did their field placement. We will require you to tell us how to improve the program, and then we'll improve it, and hopefully you'll continue to see these kind of increases over time. Okay? The last thing I'm going to show you in this regard is our employer evaluations. Every 2 years we survey our employers, the people that will hire you, and we say, how good are our students? How good are these graduates that you've hired? All right? And now this is undergrad and grad, because we can't separate them. Mountain States hires undergrad, they hire graduate. Wellmont, the same thing. Right? So in 2011, we surveyed 53 employers. We asked them to rank our students as high or highest or on the way down the list. For all of these categories, again, I won't read them all to you. The one I'd like you to pay attention to is in 2011, 90% of the employers said our students rated high or highest in overall competence. All right? Look across the board, 98% rated high or highest in ability to use technical information, and you see a few over 90. All right? 2013 survey, hot off the press, I just got it last week. I wouldn't be showing to you if it wasn't good. So now, 54 employers, 100% rank our students as high or highest in their area of competence. And you can see 3 different 98s, 3 96s, and so on, okay? Again, this idea of improving over time is something that we're committed to. It's our commitment to our students that we're going to constantly try to make sure our program is preparing you for the job market, all right? Because when you get out there, there's a whole lot of people looking for the same jobs you are. And this isn't just job market, it's also graduate school and so on. But we've got to make sure that you're ready for that job market, and that's our commitment to you. All right, so I can't tell you if will help you achieve your career goal, because I don't know what your goal is, but that's what our graduates have done. Now, what about a field that's enjoyable, interesting, and challenging? Again, I have no idea what you enjoy, what you find interesting, or what you find challenging, but I'll tell you a little bit about our alumni survey. As I mentioned, we survey graduates a year and a half to 2 years after graduation. Looking at our undergraduates, the last 4 years we've got 125 undergraduates to respond. 96% say they were very satisfied or somewhat satisfied with their educational experience. Right? 96% were satisfied, and 96% said they had or would recommend our college to others. That's pretty good. That suggests they probably enjoyed it. We also, in addition to the survey, we do have some pretty unique programs. We have some courses and programs here that you don't get anywhere else in the country. Okay? We have something we call the Essentials course for public health students, which really gives you the skills that you might need if you were in a low-resource environment responding to a disaster, working overseas as a Peace Corps volunteer or with a displaced population. You know, can you make a stove? Can you build a shelter? Can you make a water filter? Can you make a pump? That's just an example of our commitment to you to make sure you not only know what you need to know, but you can do things. In health sciences, they have a program called the Foundations course. It's just been started. It gives students hands-on practical experience. Environmental health takes folks out in the field all the time. Okay? Now, I like to say, don't take my word for it. I've got some quotes for you. This student said, the Essentials class is hands down the best class I've ever taken at ETSU. If you think about it, that may not be a good thing, but we use it as a good quote for here. The Foundation course, the individual attention and the ability to learn actually beneficial material. This is a great class. So finally, the last slide I'm going to show you is this. You know, I'll tell you, I can tell you the statistical stuff. At the end of the day, if you really want to know whether you want to major in something, all right, talk to students, all right? Talk to any group of public health students from any program, health sciences, environmental health, public health. Ask yourself, are these the kind of students you want to be involved with? Are they doing the kind of things that you might find enjoyable? Are they making a difference in the world in a way that you want to make a difference? And are they stretching their minds to work together to come up with new ideas and new ways of doing things? Ask yourself if our lecture series, where we bring in folks from around the country, is something that you'd like to be a part of. And finally, ask yourself one question. Whatever you're going to major in, ask the students, do the faculty and staff care enough about them? That's really, at the end of the day, that's what I'm most proud of. Because our motto in the College of Public Health is to give you an exceptional educational experience in a world-class environment. We want to make sure, when we say exceptional, we're not just talking about really good, we're also talking about unique. And when we say a world-class environment, we're not just talking about East Tennessee, because this is a pretty nice place to be, but we're also talking about how we treat each other. And I'd like to point out that Bucky here has the same tropical medicine degree that I do. All right, so that's my presentation. I wanted to finish with this. Remember, only you can decide, right? No one else can decide for you if a degree is going to be interesting and challenging and enjoyable, and no one else can decide for you whether something is going to meet your career objectives. Your parents can't decide, your girlfriend can't decide, your advisors really can't decide. You've got to really look into it. You have an opportunity here at ETSU to study almost any type of health science you care about, but you've got to decide which one is right for you. Okay? And you can, you can study anything. I was a philosophy major and a biology major, and I went to medical school. You can study anything you want. Do it well, take it seriously, and apply yourself. So I'm going to turn it over to Dr. Kurt Meyer, who's the chairman of the Department of Environmental Health.
I did want to thank Dr. Wyckoff, one, for the introduction, but also for laying it out on the table about doing something you enjoy. I only have 2 kids in college. One's in grad school and the other one's finishing up. I only had one piece of advice for them when they were deciding what they wanted to do, and that's to be passionate about what you want to do. And I hope they both are, and it would be the only time they ever listened to me if they did that. So, I like the picture, the stream picture, because it screams environmental health to me. I'm Kurt Meyer. As Dr. Wyckoff said, I'm the chair of the Department of Environmental Health. I'm also the graduate coordinator. I'm also one of the 2 undergraduate advisors for that particular major. We are in the College of Public Health. We're one of the 5 core areas in public health, and we are here at East Tennessee State University. You guys should be sitting around asking yourself one question. What would that question be? Oh, come on. Okay, I'll tell you what the question should be. Why the hell should you listen to me? Okay, it is a good question, isn't it? Okay, one, if you're pre-somethings, I was one of those once upon a time. Then I did a stint at a VA hospital. I learned my lesson. Okay, it wasn't for me. Okay, I did not want to be around sick people most of the time. So I moved on. Another reason is that I advise pre-somethings. Currently I have a couple of pre-meds in our program. We just graduated somebody who is trying to get into medical school. Have a couple of pre-farm people. I think that's about it right now. Okay? And the other thing was I've been doing this a long time. Before I was here, I was in a department of biology, and we had 400 undergraduates in the program, 390 of which were pre-somethings. Okay, so I got real good at telling people that they weren't going to be going to med school. Okay? If you get D's in OChem, you're not going to med school. Is that pretty accurate, Dr. Wyckoff?
Yes.
Yeah, okay. So, be prepared if you decide to go down this route, but more importantly, what happens if you don't go? Okay? What happens if you don't go? My experience here at ETSU has been that relatively few people actually go on to medical school and to dental school. PT, there was somebody here that said they were going, PT, tougher to get into than medical school. So just be prepared for what the reality is. Okay, so what is environmental health? Well, NIEHS, National Institute of Environmental Health Sciences, had the top definition. I kind of like the bottom definition. It's a branch of public health, focuses on the prevention of illness, disability, premature death from interactions between people and the natural and the built environments. Okay, so we are kind of the environmental side of this. Another way I talk to students about environmental health, we're environmental science as it relates to human health, and we are all about the science. So what are some of the topics that you're going to see in environmental health? Risk assessment, basic paradigm under which a lot of regulatory agencies operate these days. Toxicology, my favorite. What are the fate and effects of chemicals in the environment? What are the fate and effects of chemicals in you? Disease and vector control, water supplies. Water supplies important? Yeah, it was what? Oh, last week, where there was this little incident in Virginia, right? West Virginia? 300,000 people without drinkable water. What are the impacts of that? What are the economic impacts of that? Schools closed, motels closed, restaurants closed. All those fun things happening. Was that an isolated incident? Nope. Let's see, today is Thursday. Tuesday, I get a phone call about a coal ash spill in North Carolina. Okay, so another impact on human health from something that's happened with water. Air quality. What about food quality? How many times have people remembered some recall? Ground beef, spinach. 2 weeks ago in Japan, they had frozen food that was contaminated with pesticides. So these are real life, everyday happening kinds of problems. What about occupational health? What about health in the workplace? Do people care about that? Are there people that do get hurt in the workplace? We can just go down here to Human Resources on the ETSU campus and they can give you a log of who got hurt last week by slipping on the ice outside. Okay, so environmental safety becomes an issue as well. A little bit about our department. We're the only Department of Environmental Health in the state, just like we're the only college accredited college of public health in the state now. Okay? We started back in 1964. We were first accredited in 1969 and have been accredited ever since. We're a small department that allows us certain flexibility, certain latitude in dealing with situations and students. We have currently 4 tenure track faculty. I put 5 because hopefully we'll have the contract signed and she will be here in fall semester. And we have 4 part-time faculty that have been with us for a long time. Around 60 undergraduate majors, give or take a few, 10 graduate students in 1, 2, 3 different graduate programs. And we have several undergraduates that double major, biology, environmental health, chemistry, environmental health. And as I said, we have several pre-professionals amongst our students. One of the things that I think we do really well, we're a little bit different. As I said, small numbers of students, you can do different things. Our advising is done by the 2 most senior faculty members in our department. We start talking about graduation and jobs on day 1. Okay. Degrees, I'm only going to talk about the undergraduate degree and Bachelor of Science in Environmental Health. It's a fully accredited degree program. Potential careers and further education. Look at the alphabet there. U.S. Public Health Service, Centers for Disease Control, Indian Health Service, Food and Drug Administration, Veterans Affairs. We have former students at all of them. TOSHA, Tennessee Occupational Safety and Health Administration, Tennessee Department of Environment and Conservation, county health departments, the private sector, consulting firms, industry, occupational health and safety, hygiene people, and we have a number of people in graduate and professional schools. So our job placement rate is right up there with everybody else's in the college. I always say it's 95%. Because there's every once in a while a student that doesn't get a job in the field, mostly because they choose not to. If you're pre-something, and I'm focusing this on pre-med, pre-dent, pre-pharm, pre-PT, did I say pre-vet? All of those, okay? We offer the same general science core as health sciences, okay? But these are also the same general science core that you need to get into those pre-professional schools. Over here on the left are some of the courses that are required. The white ones by Quillen College of Medicine. These other 2 down here by other schools of other colleges of medicine that are close by. Here are the required classes in terms of our environmental health program. You know, general chem, OChem, physics, biology, anatomy, physiology, microbiology. They all apply. So it's not bad preparation. In terms of courses that you take during the environmental health degree, it includes things like human ecology, which is a basic environmental science course. We do require an internship experience. As Dr. Wyckoff said, it's very well received by both students and employees. Environmental analysis, which is environmental chemistry, biological analysis, which is environmental microbiology, and toxicology, which, as I said, is the study of chemicals. So those are just a few of the things that you will study in addition to your basic core sciences. Okay, so what makes ENVH a good major for pre-professionals? And again, it's a good match for what the professional schools want to see in terms of your core sciences. But most importantly, it provides a viable alternative in terms of career options if you don't happen to get into where you're going. Okay? I have one student right now, she started with us about 4 years ago and said, I am pre-med. And she's not going there. Okay? Basic reason? OChem grades. Okay? Have any of you had organic chemistry yet? Yeah, there's one. He should have had organic chemistry. I'm not trying to scare you about OChem. Let's see. I personally know 3 generations of students that took OChem. My in-laws were both chemists. My wife is actually a PhD chemist. My daughter was a biology major for her undergrad work. So there's 3 generations that have taken OChem. How many generations thought it was easy? None. Yeah, 0. Okay, so there are other courses like that too out there, but it's a reality check, okay? So, not only should you have a plan A, better have a plan B as well. One of the things that I said I think we do well, we do excellent advising, and I can guarantee you all of our faculty care about how students do, both while they're here and more importantly, how they do when they graduate. Questions? Or have I answered everything and I'm really that good?
You're good.
I'm good, yeah. I don't believe that. Yes, sir.
So you go through both Organic 1 and 2?
We only require, according to our accreditation, Organic 1. What I would do as an advisor is say, okay, you're going to do Organic 1, you want to be pre-med, we're also going to stick you in Organic 2. Same thing with physics. Okay?
Good afternoon to all of you. How are you all doing? Good? Not sleepy? You can't sleep. Our dean is the excellent speaker. It's always a problem when you follow him. You are kind of nervous, anxious, you know, everything you can think of. So I want to know actually, how many of you here are pre-meds? So, okay. Pre-PT? Pharmacy? PA? So what are the other, pre-vet? Pre-dental? Ah, sorry, good. How many pre-dental? Okay, good. So, yeah, you tell me that you are either pre-med or pre-pharmacy or pre-dental. How many of you have actually looked into the schools that you are interested in? Have you really studied what exactly they, you know, ask for admission besides MCAT scores or PCAT or other requirements? How many of you? You have? Right. That's very important, you know, because you will have to make a decision which major that you are going to go for, right? But before that, you should know what you will need to know to get, you know, better scores in whatever entrance exams that they are asking for, or to be eligible for the admissions or have a high probability of getting in, right? It's very important. And I see that majority of the students really don't do that homework. You will need reference letters. Do you really know how to get them? Or with anyone you take class, you can just go and ask, can you please write a recommendation for me? Or that person should actually know you very well to write a excellent recommendation letter, right? If you're sitting in the last bench, never asking questions, never talking to them, he'll just go back to his grade sheet and say, okay, this person got C or B or A. That's about it, right? So you have to know all that, you know, and then you can listen to me and find out whether this major is good for you or not. But you need to really do a lot of groundwork. If you are really sincere about getting into any professional school, this is my general advice to you. You know, whether you come to my major or not doesn't matter, you know, but you need to do that, okay? So as you know, as Dr. Wyckoff said, I'm a chair of Department of Health Sciences. And, you know, ours is the largest department in the college. And we really, besides teaching to our majors, we really serve ETSU by teaching many, you know, pre-professional courses like Intro to Microbiology and Anatomy, Physiology and all that, right? So why should you really think about choosing health sciences major? You know, you have to have some reasons why you make that decision that you should be a health science major. The most important you know, reason that I would give is our curriculum. our curriculum actually prepares you the best for all these courses that, degrees that medical or pre-dental or pre-PT or pharmacy, whichever program that you want to go. And I'll come to it very specifically why we think that our curricula prepares you the best. These are my contact. If you want to write down my email address and my phone, you can always contact me, okay, if you need more information. I know 15-20 minutes is not enough, right? So you can always contact me and get more information if you want to. And we also, not just a curricula, we take special care of all our majors. I really say that with a lot of pride, that all our faculty advise our majors. So as soon as, for example, you come in and you say that I want to do health science major with microbiology, we assign you a specific faculty for advising, and you stay with that person till you graduate. So you don't have to, every time, you do not have to really go and find out whom should I go, I have some questions. Who will answer my questions? I'm always there, but you know whom to go. So that has, my experience is that is helping us a lot, or our students a lot, because they are never lost. They have someone to go to when they want to know something about the program or career or whatever that question may be. So as I said, we have our major is known as health sciences, which is very kind of broad term and doesn't say anything. Health sciences can be everything, environmental health to public health to anything. So it's kind of, I don't know, maybe we should change it, But under health sciences major, we offer two concentrations, microbiology and human health. Human health we introduced in 2008, and it has really grown very fast. I still remember we had 5 students in 2008 fall, and it crossed 100 in 2 to 3 years. So now we have more than 100 in human health. One of the changes that I would like to tell you right now, that for human health since 2012, we have introduced eligibility criteria. So you cannot just get in. You have to complete biology 1110, 1120, chemistry 1110, 1120 with lab, human anatomy, and problem stat. And you have to get minimum C, and you get only 2 chances, only 2 attempts, okay? But you have to get minimum of C, grade of C, to get into human health. Then you apply. Applying is just, we want to know what grades you have, and so microbiology, there is no eligibility criteria yet, so you can actually get into microbiology anytime you want. So what are the differences actually? So microbiology, I'll show you the curricula actually. Microbiology is more focused on learning about microorganism based courses. So you have molecular genetics, you have general microbiology, you have virology, you have mycology, parasitology, right? So it's heavily microorganism based courses. While human health, and those are required courses, you have to have them, you have no choice. And then there are some elective courses. But in human health, the required courses list is only 4 courses, very short. So you have required courses like concentration specific, besides core courses. Those are just human anatomy, human physiology, biochemistry, and human genetics. Only 4 courses required. But then you have a long list of elective courses. Why did we do that? Because human health, we wanted to provide a concentration where if you choose this concentration, then you can go to any professional degree, because by choosing a list of elective courses, those are suitable for you, or to prepare you best for whatever path that you are choosing, rather than putting you in a box that you must take these courses, right? So it gives you a lot of flexibility. So that, I think that is one of the reasons why the concentration is popular. And another important reason, which I will continue what Kurt says, that organic chemistry. See, in microbiology, you have to take, organic chemistry is a required course for microbiology concentration, not for human health. It's an elective. So you can avoid that, although, if you want to go to med school, you have no choice. You have to take. But in that case, it's elective, so you are not taking extra hours. Okay, so you can actually build in to the 120 hours that you are supposed to take. So those are the actually differences in these two concentration. So how many of you actually know that MCAT curricula has changed or is going to change? So that's good. Do you know what are the changes? What they will require for 2015? Here are the changes said. Knowledge of scientific concepts and principles, scientific reasoning and evidence-based problem solving, reasoning about design and execution of research, database and statistical reasoning, biological and biochemical foundations of living system, and then chemical and physical foundations of biological system, structure, growth, physiology, and genetics of prokaryotes and viruses. This is going to be the curricula of MCAT, or the knowledge base that they will be expecting you to know, right? Now, if you remember this, look at our curricula. This is our core courses. So you have general chemistry 1, 2, right, and physics, general micro, lecture and lab, intro to public health, principles of epidemiology. You have to have, whether you are human health or you choose human health or micro, right? And then in microbiology, as I told you, that these are the fixed required courses. So you see that, right? Organic chemistry is required in microbiology. And then you have pathogenic micro, where you study about microbes which cause diseases, various diseases. Immunology, about vaccines and immunity, right? Bacterial physiology, biochemistry of bacteria. Virology, about viruses, biochemistry of macromolecules. This is very important too, because now, therefore, they have more emphasis on molecular science in coming MCAT curricula. So that this will be really important for students to really learn. And these are human health. So you see that in human health, organic chemistry is not a part of required courses. Core remains the same, right, for both. And see, there is a long list of electives that you can choose from. So this will depend on, what career you are deciding to follow or pursue. Depending on that, you will actually choose from one of these courses or list of these courses. So that's actually, that really helps you. So where do you get a job if you don't become a doctor or dentist, right? Like Kurt was saying, that you always have to have plan B. Because you may choose, it's not only the reason that you will not be, don't go negatively, that you will not be accepted in medical school. I'm not saying that, okay? I'm saying that you may change your mind, that I'm not interested in medical field now, what do I do? So it's very important that you think now, not when you are not accepted or not when you decide to change your mind, right? So if you change your mind or if you are not accepted, are you still prepared? Or you have to get another degree, So that you should always think about it when you make a decision, okay? So microbiologist, I can say that, you can get jobs in hospital health systems, public health agencies, pharmaceuticals, biotechnology, big field actually of, employment. Research labs, diagnostic labs, quality control labs. Now, quality control labs also can be a part of industry. You know that, right? Food industry or any kind of industry actually. And academic institution, of course. Earnings, this is actually a data from 2008. I don't think it has changed much from that, from 2008, since we have taken a dive into recession. So this is, the data from that. So what do our graduates do when they are employed? Right? What kind of job they do? So this tells you about that medical, veterinary, clinical microbiologists, they actually analyze samples from animals, humans, depending on where you are, and find out, diagnose what kind of organism it is, or what kind of disease they are suffering from, or what treatment is probably necessary for controlling the diseases and all that. Environmental microbiologists, you heard about environmental health and environmental sciences is parallel actually. But environmental microbiologists not only find out which microorganisms are causing trouble, but being a microbiologist and biochemist, I will tell you that they do more good than bad to us, because they play major role in environment to keep the environment actually clean. Do you believe that? They do. All this waste material that we generate every day, those are actually degraded into simple compounds by microbes, right? So they actually save us. I always say in my intro micro class that hypothetically, if you kill all the microbes on this planet, hypothetically, okay, which is not possible, hope that doesn't happen. If you kill them all, guess what will happen? All your forefathers will be still lying there, one on another, because they won't be degraded. Right? All the animals, insects, plants, everything that you bury after death, they vanish, right? How? Because microbes degrade them, kill them, right? If microbes are not there, they'll be still lying there. Their body will be still there. Pathetic, right? So that big a role that microbes actually play. Public health microbiologists, that's parallel to epidemiologists. They kind of try to find out what is the organism. You remember SARS threat, right? So that time they found out that where is this virus coming from? It came from Oriental countries, right? And what is this virus? What is this molecular structure? They detected that virus completely within 2 to 3 months, while HIV in 80s, it took 3 to 4 years to actually find out what exactly HIV virus looks like. So we have progressed so much. In 2 months, we knew what SARS is. So, public health agencies, they took all the measures to really prevent those spreads. So you have to understand that this has tremendous application actually. Immunologists study immunity, what vaccines, people are still working on HIV vaccine, right? There are so many malaria vaccine, TB, all kinds of diseases. So they work on that aspect. Virologists, as you know, I just gave example of SARS, West Nile virus. You hear every now and then new viruses are popping up, right? So we have to continuously be prepared to fight those, And remember that viruses not only create trouble in us, viruses also create or cause disease in plant and animals. So you have to study about them to keep them safe. And mycologists study about fungi. Fungi. So do you think fungi are important? For what reason? Good or bad? Good, right? Largely good, because your day starts with bread, right? So there you go. But then they produce many antibiotics, that we use, right? But they also do a lot of plant damage and all that, plant diseases and all that. So it's important. This is I'm very proud to show this slide actually, that how we have grown in the past 5 years. So we have continuously growing. I have not included 2013 data, but I'm sure it's not less than what we had in 2012. These are numbers, actually. These are also 2012 number. So, and we also have a graduate program, but not with our College of Public Health, but with Biological Sciences and Quillen College of Medicine. So we have MS and PhD both. So you can continue BS, MS, and PhD. Stay here with us for next 10 years. Okay, so these are our faculty. As I said, we are one of the largest department. We have 13 full-time faculty, adjuncts, and the staff. So I'll leave you here with this quote, which is very important, and why I chose this, because I personally advise students as well. And I often get students with 130, 140 credit hours they have already completed. Towards major, 30. Say, okay, I want to change major now. I said, then I try all this puzzle set and all that. So no, any major you choose, you still have to do 60, 70 hours more. So they end up doing 200 hours. Please don't be in that situation. Talk to someone, okay? Make a decision as soon as possible. So that's why I like this quote, that you have to act. Maybe you take an action, you may not be successful, you may have to take a different action, but still it is much better than not doing anything and be lazy. Okay, thank you. I'll leave you there. If you have any specific question, I'll be glad to answer.
Okay, good afternoon. How's everyone doing? This is a very warm room. I'm used to my office being very cold, so I'm always awake and energetic, and this is quite relaxing actually, this room, but we're gonna wake up, right? No, it's not his building. What can he do? Plus, we'll save our complaints for other things. Okay, so I guess thank you for being here and giving us this opportunity, to present to you about the programs in the College of Public Health. As Dr. Wyckoff mentioned, I am professor and chair of the Department of Health Services Management and Policy. And I want to start by talking briefly about our field. So what is health services management, or sometimes referred to as health administration? We use those terms quite interchangeably. I'm sure at some point, you've been to a doctor's office, you've been to a hospital to visit, a friend or a relative. Perhaps you've been to the health clinic here on campus. And when you think of those settings, we automatically think of the doctors, nurses, technicians who provide medical, clinical services to patients. We very rarely think about the people who run the hospital, who manage the clinic, who lead the medical practice. Those are the kinds of positions that our degrees in my department prepare you for. Okay? So we prepare our graduates from our bachelor's program for entry-level supervisory or managerial positions within the healthcare system and within the public health and non-profit systems. And they are prepared to assume a wide range of positions depending on their interests. They can work in the area of quality improvement, which is a very hot topic now, improving patient outcomes and the quality of care that they receive. They can work in the financial management of the hospital or the clinic. They can run the admissions office. They can work in the business office. They can work in the area of strategic planning and business development. They can support, the clinical staff. So really our graduates can assume a wide range, of careers depending on their interests. Or they can continue on to graduate school or to professional school if they prefer to do that instead of entering the workforce immediately after graduation. So what are our degrees in my department that prepare, again, our graduates for those kinds of positions in healthcare administration and in public health management? We offer both graduate and undergraduate degrees. Obviously, at this level for you, the bachelor's degree, is of more interest. But many of our graduates from the bachelor's degree go on to pursue the master's degree. So we offer a Bachelor's of Science degree in public health with a concentration in health administration. And I will talk briefly about the curriculum for this degree. We also offer a Master's of Public Health with a concentration in health administration and a graduate certificate. So let's focus on the bachelor's degree in public health, concentration in health administration. This is designed as a professional degree, okay? Well, and that means that it prepares you both to enter the workforce, to be gainfully employed after graduating, or to further your education in a professional school or in a graduate school, okay? And our graduates choose either path. Okay, either path is common. Our curriculum for the bachelor's degree includes, beyond the general education curriculum, a series of core courses that address the core disciplines of public health. So in the core courses, you will take courses in epidemiology, in biostatistics, in community and behavioral health from Dr. Slauson's department, in environmental health from Dr. Meyer's department, as well as in health services administration. Then you go into the concentration courses. And those are the courses that are offered, by our department specific to health administration. Those are courses in health services planning, in quality improvement in healthcare, in budgeting and finance in the healthcare sector, as well as at the undergraduate level. We also require a course in research methods. And we are getting ready to expand the concentration courses to include health informatics, which is an area that's very much in demand today, as well as a course in health law and ethics, again, very much in demand. So we're constantly updating our curricula to make sure that the curriculum is responsive to the needs of employers and also prepares you for graduate school. A unique feature about our degree is the field experience or internship. This is a semester-long opportunity where our students go out, okay, and complete the equivalent of 12 credit hours or 400 service learning hours in a hospital setting, in a clinic setting, in a health department setting, to gain practical skills, to apply the knowledge that they have learned, and to help jumpstart their career, or to help them decide, what kind of graduate degree or professional degree is best for them. Okay, and this field experience, we have found it particularly helpful. Our students love it, and it really gives them an advantage in terms of employment relative to other graduates from other degree programs that don't have that semester-long internship experience. Okay, so what's in it for you? Why should this degree be of interest to you? Obviously, you're pre-health students, you're interested in science. This is a science-based discipline with a focus on analytical skills. There are lots of opportunities for professional development. As I mentioned, a wide range of career options, not only in terms of the settings where you can work, but also in terms of the types of employment that you can assume. There's an excellent earning potential, and I will share that with you in a minute. Advancement opportunities, job security in the largest industry in the US. It's not the automotive industry, it's not the nuclear industry. The healthcare industry is the largest industry in our country. So the career outlook is excellent for the field of health administration. Today, about 100,000 people work in this field, from middle management to executive positions. The field of health administration is expected to grow rapidly. Over the past decade, employment grew by about 30%. This decade, employment is expected to continue to grow by 22%. Okay? And developments like healthcare reform, electronic health records, quality initiatives, all of those integration of healthcare are expected to continue to increase demand for graduates from health administration programs. This slide shows average salaries for healthcare consultants, hospital administrators, medical practice administrators, and as you go up the ladder, chief operating officers and chief executive officers. Now, obviously, those are not the kinds of salaries that you can expect immediately upon your graduation with a BS degree, but those are salaries that you can expect and should expect with few years of experience, and particularly if you go on to do a master's degree in this field. In addition to this chart, I will share with you what's on our flyer. The median annual income, again, of health services managers in 2010 was $94,000, and the middle 50% earned between $85,000 and $109,000, all the way up to $145,000 for the highest 10%. So again, excellent earning potential, particularly with some years of experience and a graduate degree. Where do our graduates work? Again, hospitals, health systems, clinics, public health agencies, medical practices, international health organizations, health insurance plans, Blue Cross, Blue Shield, managed care organizations. The long-term care industry, again, is experiencing rapid growth as the population ages. So this is the nursing home industry, home health, assisted living. Some of our graduates go into the industry and policy analysis. Now, why would you want to pursue a degree in public health with a concentration in health administration here at ETSU? We're not the only program in the country, obviously, but we are a nationally accredited program, and we are actually this year going through our re-accreditation cycle. As I explained, it is a professional degree focused on practical skills. The internship requirement is very valuable, and we're getting ready to add a series of mini internships in the form of a skills and encounters course that will be integrated throughout the last 2 years of the program. Opportunities for graduate education. Our classes are relatively small. In my department, the average undergraduate class, bachelor's class, is between 20 and 30 students. So you are not in a big hall, 100 students. There's no way for your teacher to know who you are. Okay, we're relatively small. You get to know your professors get to know you. You get individualized advising and personal attention. And I'll share with you quickly some of the outcomes, the learning outcomes of our graduates. This data is based on the 3 most recent alumni surveys. We do monitor regularly the outcomes of our educational programs. We conduct exit surveys with our students, alumni surveys, preceptor surveys, employer surveys. Dr. Wyckoff likes to say that we can tell you anything that you want to know about our students and our graduates, and he is right about that. So this is data from 65 graduates of our bachelor's program in public health, both concentrations, health admin and community health. So this applies to community health also. Combined the data from the 3 most recent surveys, 97% of those 65 graduates reported satisfaction with their educational experience. 95% agreed that they had or would recommend our college to others. and almost all, 97%, were employed or continuing their education at the time of the survey. Okay, this is a sampling of the over 175 internship sites that we have affiliation agreements with. So again, in terms of where you go for your internship, you can decide. You want to go into a hospital setting or a public health setting, a nonprofit setting, locally, internationally, your choice. And those are some testimonials from our recent students and graduates. This is during a visit that Vice President Gore did to the college. Jenny completed both her bachelor's and master's programs with us, and she now works in the area of quality improvement with Mountain States Health Alliance. And this is the last slide, some useful websites that you may like, to check. Okay, and I believe I am right on time. I don't want to cut into my colleagues' time, but I do have, departmental flyers summarizing the information that I shared with you, with our contact information, and also pens for you to take home with you tonight. Okay, so make sure you collect your goodies on the way out. Thank you.
Well, I'll finish up just real quickly, let you guys know, of course, with the Community Behavioral Health Department, we won't have time for the slides, of course, but to let you know that we have a wonderful plethora of opportunities for students that have any interest in community or behavioral health. And as was mentioned, my background is registered dietitian. I come from a clinical background, and being able to use that as a jumping off point to work in preventive health and everything that relates to preventive health. That's why I am the be-all and end-all for community behavioral health. Looking now at how we can impact people's behavior and choices to make wiser choices in their lives. And that's the kind of things we give our students. We have programs we offer from the bachelor's, master's, and doctoral levels. So we have a very active department. We represent all across the community. We have very active engagements and ongoing interactions with people in the community. And encourage you to step on down anytime. And please don't hesitate to contact me, phone or email. You can get me through Dr. Wyckoff's contact info, and I'd be glad to talk with you or talk with any student group that you have that would like to learn more about community and behavioral health. Okay, thanks a bunch.